As chair of the Global Commission on Drug Policy and as founder of the Latin American Commission on Drugs and Democracy, I have been working hard to break the taboo and challenges the status of the war on drugs as an inefficient and counterproductive strategy. It does more harm than good in terms of citizen security and public health. Although human rights abuses are widespread on the war on drugs in most parts of the world, they come about in different ways. In Latin America, the main issue is mass incarceration, violence, and corruption, and the strengthening of organized crime. In other countries around the world, especially Russia, East Asia, and the United States, the criminalization of injectable drug use has led to a major crisis on public health, with prevalence of HIV/AIDS and hepatitis C rising among drug users. In 2012, the Global Commission on Drug Policy released a report that outlined how the war on drugs is driving the HIV pandemic among people who use drugs. Now, with this new report, the negative impact of the war on drugs on public health, we are exposing the links between repressive drug policies and the spread of hepatitis C, another massive and deadly global epidemic. The report documents how the war on drugs is driving transmission of hepatitis C. This is another concrete example of the failure and negative impact of repressive drug policies around the world. Authorities must recognize the failure of the war on drugs to reduce drug supply and consumption. It is high time to move away from conventional measures of drug law enforcement success, such as arrests, seizures, and convictions that do not translate into positive effects in communities. Drug policy success should be measured by indicators that really have meaning to communities, such as reduced rates of HIV and hepatitis C transmission, fewer overdose deaths, reduced violence, and lower rates of substance abuse. Those will be real success of policies committed to improve quality of life, health, and safety. Repressive drug policies are ineffective, violate basic human rights, generate violence, and expose people to unnecessary risks. Hepatitis C is one of these harms, yet it is both preventable and curable when public health is at the core of the drug response. The taboo of the drug debate has been broken, and failure to take harm reduction to avoid thousands of new deaths is criminal.